afternoon, everybody. Out of many skin diseases which we see in our daily practice, eczema is one important condition which we see daily, and people suffer from this condition a lot. Let's have a small discussion about this eczema, its etiology, and what are the effects of eczema and its treatment option. So what is eczema? Actually, to call eczema is inflamed skin. It's not a normal skin, it's an inflamed skin, where it's inflammatory skin condition which causes severe itching. It's a most important symptom which patients say. Patient come with dryness or rashes, scaly itchy patches, or blisters, and even skin infections in some cases. Okay, so symptoms of eczema. Every individual have different types of eczema according to their presentation, lifestyles, or the allergens they're exposed to, and many such factors. Okay, so the symptoms even differ from person to person. The most common symptom a patient with eczema presents is itching and a dry, inflamed skin with the discolored skin. Okay, and some people present with the rough, leathery, or scaly skin, appearing as scaly patches in the skin, and dosing or oozing, or sometimes they have a crusting also. Okay, oozing, that is a serious discharge from the blood, or severe itching, they have a blood discharge from the skin also. And severe cases, they come with areas of swelling, even cellulitis in some eczema. Okay, so what does an eczema rash look like? Okay, eczema can have different pictures depending upon the skin color. A fair skin people can have a reddish erythema-like skin or inflamed skin. With individuals in dark skin can appear as grayish skin or ashen skin, a dark brown or purple in color sometimes, depending upon the person's skin color. Okay, so what is how common is eczema in India? Like many other infections, like fungal infections, other things. Okay, according to Global Asthma Network Phase 1 in India study, about 2.5% of 6 to 7-year-old children, 6 to 7-year-old children get this eczema, and around 3.5% in 13 to 14-year-old, and 10% of adults get this eczema. Okay, suffer from this eczema. So what are the causes of eczema? Eczema is basically caused by three main factors: overactive immune system, mutations in the genes, or environmental and emotional triggers. These are the most common causes of eczema. So eczema can occur in any of the following causes. Overactive immune system means the eczema patients have an overactive immune system, whereas an external factor or irritant allergen touches the skin or penetrates the skin, the immune system recognizes it as a foreign body or enemy-like thing and creates a reaction which further causes the symptoms of eczema, like inflammation or itching and other things. Okay, some patients have genes of the patient, some patients have genetic predisposition to this condition. More common individuals, family history of eczema. Sometimes people with atopy, called atopic eczema, and some people with history of eczema, family history also get this eczema. Such individuals may have altered gene which does not allow the skin barrier to stop this allergens getting in. So they are prone to get eczema in such conditions. And third important point may be environmental factors where we live in are predisposed to eczema, including exposure to smoke, air pollution, harsh soap fluids, detergents, occupational exposure, maybe a construction worker, a oil handler, or many things are there. So they are exposed to many chemicals from outside. So they are prone to that eczema. So, and occupational dermatitis, what we see is eczema is more common in our condition. Other causes such as air pollution, harsh soaps, fabrics, and skincare products also cause eczema. And now presently people use self-medications, cosmetics, and those things can cause eczema, irritant contact dermatitis, as they contain some molecule which cause an allergy to the skin. So in our climatic conditions, low humidity or dry air also makes eczema skin itchy and dry. And there is one more interesting factor in the eczema is emotional triggers. High level of stress, anxiety, and depression can flare up eczema symptoms very easily. And they keep the stress, to divert the stress, they keep scratching in some areas and relieves their itching, but in turn it's a cycle, it causes eczema again. So eczema, which body parts commonly affected by eczema? Skin on any part can show symptoms of eczema, but the most common parts which get affected is hands, neck, elbows, knees, and even ankles can get affected. Feet, face, especially the cheeks, and in and around the eyes, and also the lips. Okay, so it doesn't spare any part. Mostly eczema affects most of the skin sites here. Okay. Does eczema cause pink skin or skin pain in the skin? Anything like that? Yes, eczema does not cause pain, but however, scratching the eczema in a chronic condition leads to an infection with cellulitis or a severe irritant dermatitis can due to secondary infection can cause pain and severe fever and general symptoms also. Sometimes like irritant contact dermatitis, the contact dermatitis, what I told you, which they're using some secondary to some material, can cause a burning sensation and discomfort. Okay, so what are the triggers of eczema flare-up? Common triggers that cause eczema include dry weather, which we see some conditions, fabrics or clothing material, smoke and pollutants, soaps and detergents, and stress and emotional well-being. Touching something like a person who is allergic to can cause an eczema. Okay, these are the most common conditions which trigger these factors. So is eczema contagious? No, in that way, it's like other conditions. It's not an infection as such, it's an inflammatory condition. So we don't see any focus of spreading of this infection to other person, and it's not contagious. So in that way, it's definitely not going to spread to other person. Okay, right. So is there a cure for eczema? As such, there is no direct cure for eczema, but we can prevent eczema and bring down the symptoms of a patient based on the approach we give to that patient. Okay, so there are treatments which will help in the management of eczema. Treatment plans to be tailored according to the patient's individual eczema symptoms and their need also based on their occupation or what they are exposed to. Those things you have to take in mind. These factors are very important. And treatment depends on the age of the patient and the severity of the condition with which he comes to. Okay, so how will we manage this eczema? For few ways to manage this eczema are basically we can use some moisturizers to prevent from skin from becoming dry. The dry skin is very prone to itching and they can scratch and they develop into eczema. So moisturizing the skin is a very good thing we have to do. So advising some moisturizer to be applied gently throughout the day will help prevent eczema so that the skin becomes damp and barrier is intact. Okay. Topical medicines, applying medical medicines like topical steroids, plain steroids or combination with an antibiotic creams that depends upon the patient need and the presentation will be decided by the dermatologist who is attending such conditions. Okay. Oral medications, do we need? Yes, we need some oral medications. Patient can develop symptoms of itching. So we need to control that itching, which is the main symptom, which disturbs the patient more in their daily lifestyle. So need to give some antihistamines or anti-inflammatories and maybe an antibiotic in some cases where we see with secondary infections. So these conditions will control the eczema. And immunosuppressions and injectable biologicals, these are some new variants which we can use in case of where we suspect some immunity-based disorders or there's overactive immune response in that eczema as a background. So we can give some immunological modulators, corticosteroids and those things we can give, which will work in these conditions. So phototherapy or light therapy helps in appearing some treatment helps in the treatment of this eczema in some conditions. In the hand and foot eczema, sometimes responds better to a UVA treatment or UVB treatment, depending upon the presentation. Some patients get good benefit in this. So is that a treatment alone or giving such medicines are going to cure eczema? No, it's not like that. Which factors have triggered this eczema has to be investigated, get the history from the patient. We have to know what triggered the eczema in this patient particularly. What occupation he is, how frequent he is exposed to that allergen, and factors which can control that allergen or any occupational changes he could do or protection he can take during his occupation can prevent the triggering factors and prevent in flare-ups also. So what type of moisturizers do help in management of eczema? Ideal moisturizer should be hypoallergenic, fragrance and dye free. Okay, that's very important. You should not have a smell in this moisturizer. Gentle for sensitive skin, contains petroleum jelly or some mineral oil. Do not have preservatives or stabilizers in that moisturizer. Have lipids and ceramides to improve the skin barrier. That's very important. That's the main protection the eczema should get. So it's better whoever is affected, talk with your doctor and get a proper moisturizer of choice. Don't just go for self-medications and wrong moisturizers. Okay. So is eczema has complications like other disease? Yeah, some complications are there. Possible complications with eczema include a weeping eczema. Skin forms fluid-filled blisters, multiple blisters, and these blisters can be more disturbing. And in some cases, some secondary infected eczema, infection sets in with this eczemas, can form a huge swelling in that affected area or edema, and bacterial, fungus, or viral enters the skin, resulting in severe infection. Patient may come with the general symptoms like fever also, and may need to manage the general symptoms of this eczema with oral antibiotics and other general measures. So to conclude with, or to summarize, as we see eczema in day-to-day practice, like any other condition, eczema, like compared to other conditions, is more wide, as many endogenous factors and exogenous factors, inside and outside factors. What exogenous factors could be controlled? We have to analyze what causes the eczema and what is that lifestyle, depending upon the patient. As we discussed earlier, patient custom made, we have to decide what he needs and what are adjustments he could do to prevent the eczema. So as eczema is to conclude, we can say it's an inflammatory skin condition with redness, dry skin, or scaly blisters and skin infections. And secondly, we discussed immunology, immunity system, overactive immune system, family history of eczema, and allergen and emotional triggers like stress, anxiety, depression can cause eczema. Ways to manage eczema include applying a moisturizer. First thing is identifying the allergen and what causes the eczema. Is any history of any family history is there, and treatment includes using a moisturizer like or topical corticosteroids with combinations, or anti-inflammatory agents, oral antihistamines, or corticosteroids oral in some conditions to control the eczema, and other medications like antihistamines and immunosuppression agent drugs. Phototherapy and other agents can be used in such conditions, and main importance avoiding the triggers which we have investigated. So this is an overall concept of eczema which we see in daily practice. So let's first, a patient comes with a clinical symptom of eczema, just get the history, see that what is exposed to, and why is getting that eczema, any conditions, any predisposing factors are there. His general comorbid conditions can be analyzed, and any allergen factors triggering can be advised to be removed or make some adjustments of patient. Endogenous eczema, immunological factors, and any family history, those things has to be analyzed. Treatment depends upon the patient who presents with eczema, maybe an inflamed skin or it just comes with itching, depends upon the mild topical medication, or severe conditions we go for an antibiotic and other systematic approach. So this is our overall conditions in eczema which we can think, and we can treat the patients so that we can give them a comfortable skin so that they can be happy with their conditions. Thank you.